In this video, I'm going to talk about restraints. Not only am I going to show you and talk about the documentation of restraints, but I'm going to show you the order that you need for restraints and also the other IDPH requirements that goes along with placing a patient in restraints. So the first thing we're going to start on is the tracking shell. We had a patient that was straight back from triage into room 15. Obviously handle your patient first and then come back to your documentation. Okay, so the first thing that I would do when I get a second to document is I would actually right-click in the alerts column and I would set a no visitors icon, so that way the volunteer and security knows not to just send family right back, so they can call you first. So I'm going to hit OK. So that puts my stop sign on there. So the next thing, probably the most important thing, is the order for restraints needs to be put in next. Now this primarily falls to the physician to do, okay? But if for the case the doctor's busy with a code or for whatever the reason is, I'm going to show you how to find and put in those orders. So I have my patient highlighted here, where I'm going to go to open my chart and I'm going to go to the orders page right here after I click this. Now that I've clicked it, it brought me to my orders page. I'm going to add an order to the patient's profile, so I click add. And once I hit add, my search window comes up. So we're going to find, there's a couple ways to find the restraint order. What I want to show you is the power plan, the ones that the docs use. You can use this also. So type in ED space B, as in boy, and that brings up the ED Behavioral Health Power Plan. Okay, so click this guy, and you're going to have to put in the physician's name here. So I'm going to pick on Dr. Sager. So we'll put Brian in there, and then this is actually important. If you talk to him on the phone, right-click phone, or if it was a verbal face-to-face, it's verbal. I'll just put phone. I'm going to hit OK. I'm going to hit done here to move this search window out of my face. So this brings up the power plan. Here's the name of the power plan, and here's the guts of it. All right. So there's a couple things that are pre-checked. There's a crisis worker consult that's pre-checked. Leave this for the physician. You're concentrating on the restraint order right now, so uncheck this. If you happen to forget and not uncheck it, it's no big deal. This order basically just sends a reminder to the social worker to come see the patient. Okay, but you're concentrating on restraint order. So down at the bottom there is one more pre-checked order, and that's vital signs. You know when to take vitals on your patient. If the doctor wants to order this, have him go ahead and order it, but otherwise I would uncheck it. So here are the two orders that you need: restraint for violent and restraint for non-violent. All right, so I'm going to click on both because I want to show you the details of both. In this power plan for the violent restraints, you're going to see this little drop-down arrow. This just gives you different choices. It's already set up to put in there for immediate dangers to others and lock limb. Now, if it was, when I click on here, immediate danger to others, and if it was just a waste, I would just click that waste, and that automatically puts the order in for you. But since we want lock limb, I'm just going to click this guy, and it brings up the details of this order. Alright, so priority is stat. I'm just going to take you right through it, the details. Priority is stat. The restraint location, this is a little tricky because if I click left wrist, it only puts one choice in there. So you have to hit control. When you hit control, then you can click the rest of your choices. Like right wrist, left ankle, right ankle. Okay, so hitting control makes you pick, lets you pick multiple choices. So once I put that in there, the duration is set to hours. Which is important when you get to what is the duration. The next one, though, is requested start and date and time. This is important. I'm going to put my cursor in here and hit T on the keyboard. That puts today's date. And if I go into the time section, that puts now, which is the now time. You want this time to mimic when you actually start your documentation for the restraints. So a communication needs to happen here between you and the physician. All right, so even if you're not putting in the order, there should still be the, hey doc, I started my documentation, or the restraint started at about 9 o'clock. So that way this order and your documentation is going to mirror each other. IDPH looks to see, well, was the order put in way past when documentation was started, which could be a problem. So make sure the order, request start and date and time, kind of matches the one that you started on your documentation, which I'll show you later on. So I'm going to say that this started at 9 o'clock. All right. Violent restraint type is lock limb. That's what I have. There's any special instructions, which I don't need. Here's immediate danger to others, or if it was self, here's self, but we'll keep it at others. And then the duration. So I have an adult patient. She's 113 years old. So this order is good for 4 hours. Okay, here's my hour. All right, so this duration is 4. Now, that is for 18 years and older. It's good for 4 hours. This means, and I'm going to stress this point, after the 4 hours is done, a brand new order needs to go into the system if you need to continue restraints. Okay, so if there's anything after this 4 hours, they need to place another exact order just like this. All right, very important. And that's good for 4 hours an adult. If it's 17 to 9 years old, it's good for 2 hours. If it's 9 and younger, it's good for 1 hour. Okay? So that yellow didn't go away, but I clicked into here to make it go away. So now all of my violent restraint details are filled out. So then what I would do is hit orders for signature, but I do want to show you the non-violent details. So I'm just going to click on this guy just to kind of show you. It's kind of the same idea. Restraint location works the same way. Hold control, multiple choices. Request start and date time works the same way. Non-violent restraint types, this is nothing fixed, but here's, usually it's soft limb. The reason for interference with medical device treatment, just to kind of give you the gist of the details of this order. Okay, but we're mainly going to concentrate on the violent one, so I'm just going to uncheck this guy. Now that I have this order, I'm going to hit orders for signature. Once I do that, it's going to bring me to my scratch pad, we call it. When I hit sign, this order is valid now, and it gets dropped on the patient. So once this is done, you have fulfilled your orders capability for a restrained patient. So now I'm going to concentrate on your documentation of restraints. So since we're in the patient's chart already, I'm going to bring you to ad hoc. That's where your forms for restraints are kept. Now there's two different ways to chart restraints, and they're both valid. So you can go to ad hoc to grab your restraint form, or if you're used to iView, you can go to iView and the same sections are in there. I'll cover the iView part a little later after forms. But I'm going to go ahead and click ad hoc, and it brings me to my list of forms that are available to me as an emergency room nurse. So here you're going to see my restraint for nonviolent and my restraint for violent. I'm going to concentrate first on the violent, so I'm going to double click this to open it. So I double click my violent restraints. Here's my form. I'm going to go through each section just to kind of let you know what it is. So here's the alternatives attempted prior to restraint application, so just click a few choices, whatever's applicable for your patient. The next one over here is the face-to-face assessment done. This is not for you to do. This is a doctor responsibility, but in your charting, you need to reflect when that doctor actually had a face-to-face with the patient. So usually it happens, the doctor comes to the room while they're restraining the patient. That's considered a face-to-face, okay? The doctor laid eyes on the patient. Now, it has to be within an hour the doctor needs to document a face-to-face, okay? But this is just the time that the doctor actually seen the patient. So if you don't know if the doctor was there, you can gently remind them, hey, did you do a face-to-face assessment yet? And then when you do, you can come fill this time out. Okay, so I'm just going to go in here and put T. If you remember from the order, we put it in at 9 o'clock is when we kind of started. So I'm going to go in here and hit N. And so this time is totally fine because it needs to be within the hour. All right, that's your face-to-face. The next one down here is your restraint initiated time. All right, you'll see it's yellow. It means it's required. Okay, so this is the important one that needs to match the order or come very close to that time at 9 o'clock. So I go into the field, I hit T, time I hit N, that gives me the now time. So at 9:14, I'm just going to change this back because this is when I actually started with restraints on this patient at 9 o'clock. Okay, and that way it kind of matches the order. So that's why that communication needs to happen between you and the physician. So the next one here is reason for restraint. Immediate danger to self or others. It's a multi-check. Here's the important part about this. This other box has to be filled out. And in this other box, you have to put a personalized reason for that patient why they're going into restraints. This is an IDPH requirement. So if the patient was punching, you can be a little bit more elaborate than I am, but if they're punching, kicking, whatever the patient's behavior is that warrants restraints, that needs to go in this other box. Okay, so I hit OK. So you're probably going to ask me, well, do I have to click these boxes then? No, if you want to just put the other and put punching or kicking, that's fine. At least you're putting a personalized reason. All right. The next one over is criteria for release. I don't want them to threaten me anymore, so that's the one I'm going to click. The next one here is initial environmental safety. So yes, you did your contraband check because all belongings should be taken from the patient and they should be placed in gowns, and usually the belongings go with security. Okay, and also the one-to-one supervision. A sitter should come down from the staffing office, but usually we use your techs to sit there until they come. So this is the other box that should be checked. Going down here, I would just go ahead and ignore this total time and restraints for right now. Communication with patient. Restriction of rights provided. So this box needs to be checked. Now, what does this box tell anybody when they read this chart? This tells them that you've actually given the patient their rights of the recipient and notified them of their restriction of their rights. Okay? So what this means is I'm going to go into your SharePoint here. is this rights of recipient, which is in your restraint packet, that's probably in the column in the wall in the ER, has this form where it says rights of recipient. Fill the top out. This is 2 pages, and then the bottom you sign it, and then sticker it. Okay? Now, a copy of this needs to go to the patient. All right, so put it in the patient's belongings, which go to security, but it needs to go with the patient because it's their rights. And obviously, you notified them of their rights, and this is a way that you do it by giving them this paper. The other copy, you need to make another copy of this and put it in the patient's chart. So down here at the bottom, you need to put a patient sticker, and it needs to be placed in the patient's chart. So if they're auditing this chart, there's proof that you gave this rights of the recipient to the patient. Okay, so 2 copies, one to the patient, one to the chart. So that's rights of recipient. This next one here is notice of restricting their rights. This is the same thing. This needs to be filled out, 1 copy given to the patient, 1 copy stickered and placed in the patient's chart. Very important when they audit this chart that this needs to be done and that you've presented this to the patient. Okay, so these 2 pieces of paper stickered in the chart with the patient. All right. So the next part we're going to go over here is communication with family or significant guardian. If there is no family, you can pick no. Okay, so it's just kind of whatever's there. Here's any information that you can contact family. You can type it in here. It's free text. Physician notified is your next box. So when I check that, this basically means that I notified the physician and they must do a face-to-face within that 1 hour. It's a little easier for the emergency room because we work hand-in-hand with the physicians, where if it was the physicians on the floor, they would have to be called, they'd have to come in and actually do the face-to-face within that hour. So we have it a little easier when it comes to this part with restraints. The next part is what kind of restraints. We'll just put locked, and it was kind of the same thing on the order here of what kind of restraints it is. This part's yellow, so it has to be filled out. Okay, so we're going to do whatever we did prior to putting them in restraints. I just put restraints so their skin's fine. It's not too tight. Breathing is fine. Not applicable here because I just put them in restraints. Usually activity, you can normally do range of motion to make sure the restraints are not too tight. The outcome right now is we're going to continue because I just placed them in the restraints, and we did the contraband check. All right, so with this, your initial restraint documentation is done for right now, okay? The only added piece that I want to add to this, all right, is if the patient's condition or their behavior warrants medications to be given to them, if they need some medication, there is one more piece to the puzzle here, okay? There is, and I'm going to bring it up for you. Actually, let me show you the other picture here. There is this green sheet order with this sticker on it. This needs to be filled out by the physician. Okay, it's a few check boxes. So it's sideways, and I apologize, but I wanted you to show you the whole sheet. This guy gets checked, and then the doctor signs it, dates it, and times it, and it gets stickered and goes into the patient's chart. All right, this is very important if medication was given to the patient. All right, so let me show you the other picture just to give you the. And how about I turn it for you? So this is the check boxes that need to be filled out by physician. All right, and this is the checkbox if the patient has not refused a medication. Okay, that needs to be filled out by the physician. All right, but this is the other piece of the puzzle that needs to happen if medication is given. Also very important. So if you notice it's not done, I think we're going to have these in the physician's charting rooms, easily accessible, so they can just take it from a little mailbox in there and fill it out. But I would give this to the physician so that it reminds them to fill it out and just stand there. It takes a few seconds for them to check the box, give it back to you, sticker it, put it in the chart. Okay, that way you have a lot of the IDPH requirements met. All right, let's go back to the patient here. So now that I've done my initial charting, I'm going to hit the check box and I'm good. So let's play the role of it's 15 minutes later. Violent restraints need an assessment every 15 minutes. Okay, non-violent needs every 2 hours. But here's my violent behavior. So I'm going to double click it again to go back into it. And if you notice, all of my information pulled forward. That's the idea. You don't have to fill this out again because this was your initial. It shouldn't change unless, let's just say, a family showed up. You can change it. So let's say, hey, family informed. So family showed up, so now the family was informed. So I can change stuff. But the bottom part is the section that you want to be concentrating on when you reassess. So same thing. Pick whatever you need to pick. If there's action required on skin or respirations, these sections open up. But for my patient, they're doing good. I offered. We did a range of motion. This field here, if the patient can come out of restraints and you click discontinue restraint, this field comes available to you, and this is where you put the documented time that you took them out of restraints. Okay? So I'm just going to keep it on continue for right now, but it works the same way. You hit T, you hit N, and that puts today and now in there. So I'll just hit continue, and we're maintaining one-to-one supervision. Okay? So that is your basic initial eval of the restraints and your reassessment. So every 15 minutes, you need to go into ad hoc, get this form, not modify it. You need to go to ad hoc and get a new one and fill out the bottom section every 15 minutes. Okay, I understand that things happen, so you can just back time the time that you've actually checked on the patient right here to reflect that you've been checking on them every 15 minutes. Okay? So now once I did that, I check it. That is done. Now I do want to show you the iView version of it. So here in iView, it takes a second to open up. It's under ED Patient Care. So I'm going to click on this little navigator bar. It brings up here. Here you're going to see restraints for nonviolent and restraints for violent. You notice a check mark? That means that you've documented on this. The forms talk to iView, so all that information populated there. So when I click on violent behavior, you'll see it pulls it in here. Here is my initial, and here is my reassessment. So everything pulls to iView. If you like to just go right to iView, that is totally fine. You probably know how iView works. Double-click the column to activate it, and then pick your choices, which are the same questions as that they are on the forms. I kind of like the forms a little better. It gives you little reference text sometimes if you're lost. But if you're used to iView, go right ahead. Here you can pick your choices. You can either hit the X or hit Tab to bring you to your next field, and you get the gist. It comes down all the way, and you would just come to iView and fill this out every 15 minutes if that's what you choose to do. All right, so that's basically how to document on a patient for restraints. There's two more points that I want to bring up about the chemical management side of this video. In your restraint packet that you have in your column in the ED, this is your packet here that has all the rights recipients, which I showed you there. This one here, the provide the patient and parent or guardian with written information regarding the medication. In this packet, you need to supply the patient or family information about the medicine that was given to them. All right, so in this packet at the bottom, you'll see there's all the subjects of, so here is Haldol. So they're in your packet. You just need to give a copy to the patient. So when I say copy, even on the rights of recipient, I mean give a copy to the patient to put in their belongings, then put the original in their belongings bag that go, or I'm sorry, in the chart. Okay. So when I say copy, give the copy to the patient, put the original one that you filled out into the patient's chart. Okay, so same thing with the medicine, rights of the recipient and the restriction of rights. Okay, so the other part that I just want you to be aware of, not that you have to do anything on, is this green sticker, which I already covered for you. This last one here, the doctor does have to document in their note if it's kind of a double negative here. Does the patient, basically what they're saying is that the patient refused the medication. If the patient did, and most of the time when you're putting them in their restraints, they're probably refusing a lot of treatment. The doctor just has to document why they're giving the medicine in their note, just so you know and are aware that if they do click yes, the patient's refused, then they need to document in their note. So those are only the two caveats that I want to show you. So technically, if you're restraining the patient, putting them in physical restraints, and also using medicine to help manage them, 3 sheets of paper need to go to the patient, or 3 forms need to go, and also those 3 forms need to be stickered and placed in the patient's chart, the originals. Okay, so that should basically cover restraints for you guys.